We all make decisions big and small every day of our lives. Most of us are able to make these decisions by ourselves. There are many people accessing our health services whose ability to make certain decisions about their life and choices may be affected by a disability, an accident, a medical procedure, or a chronic illness, either on a temporary or permanent basis. A new law called the Assisted Decision-Making Capacity Act 2015 has been passed, which gives people the right to be assisted to make decisions with legally recognised supports regardless of disability or any condition which may affect their decision-making capacity. The Act is for everyone over the age of 18 who has difficulty now or who might in the future have difficulty making decisions. A number of decisions are covered by the Act, including day-to-day decisions, what to eat and what to wear, through to more complex decisions like whether to buy or sell a house, or to have a surgical procedure, or what to do with a large sum of money. All services are covered by the Act: banking and financial services, legal services, and health and social care. A number of key features of the Act include: a person has capacity until proved otherwise. A person should be supported to make decisions as far as possible. Information should be provided in a way to a person that is easily accessible. A person has the right to make an unwise decision if they choose to. A person can make an advanced decision about their healthcare treatment, which will apply when she or he can no longer make those decisions. The wards of court system will be abolished and a new system will be put in place. A new body called the Decision Support Service has been set up to oversee the Act and is based in the Mental Health Commission. The Decision Support Service has a number of functions, including public awareness of the Act and supervision of the decision-making support arrangements.
The Act puts me in charge of my life. It means I can get to make decisions when I want it, but I still making my own choice. This Act is great because this is my life and I have the same voice as everyone.
This Act matters to me as Damien's mum because it makes it clear that Damien has the right to make his own decisions, which is really important. It also means that we can get information and advice that he might need to support him in his decision making now and in the future. The Act also provides reassurance for me that when I'm not with Damien, that he'll be able to get appropriate support to make decisions in relation to all aspects of his life, but that his right to make his own decisions will be safeguarded.
I'm currently making my wishes and preferences known to my husband and sons. If I suffer a serious illness or there is an emergency which affects my ability to communicate, my family will know what I would want, and with this knowledge will be able to support me while at the same time making sure that my rights as a human being are respected.
This new Act encourages us to plan and think ahead, which is so important for us all. The Act will allow me to be legally recognised as Veronica's support person.
The Act allows people to plan ahead and put in place legal binding arrangements about the healthcare treatment they do not want when they no longer have the capacity to make this decision.
I don't want my family making all my decisions. I want to make them myself, while I still can. This is my life and my decisions.
This Act matters to me because I will be able to support individuals that I work with to make their own choices in life and to be more involved in what happens to them.
This Act matters to me as a dentist. It is important that the patients I treat have a full understanding of their dental care and treatment options, and that they are supported and enabled to make decisions in relation to their own oral health.
The acts that matter to me because I won't lose all my rights to make my own decision, which is what can happen if a person is made a ward of court. Even if I can't make my own decisions, the Act keeps my wishes and values and beliefs at the centre. There can be no decision about me without me.
Assumptions should not be made about a person's ability to make and communicate decisions based on an initial diagnosis, especially in the case of a severe acquired brain injury, where the condition of the person can improve over time.
Pádraig enjoys life, and a big part of that is being able to make decisions and to let us know what he wants. These decisions range from basic day-to-day decisions, what he wants to eat, what he wants to watch on TV, to more complex decisions about care and treatment. And sometimes Pádraig's decisions surprise us.
I represent public health and community nursing services. We as nurses hold a very privileged position of entering into people's homes and of witnessing the reality of how patients live their lives. Therefore, I wholeheartedly embrace the opportunities that the Act will bring for patients to shape their healthcare decisions. The Act provides an opportunity for patients to have a voice and represents an approach which appreciates the values, needs and preferences of each and every patient. This is achieved when patients are facilitated to become informed decision makers and exercise their choice in a shared decision-making process.
The Act provides legislation for advanced healthcare directives. This is where a statement is made by a person with capacity setting out his or her will and preferences about medical treatment which may arise in the future at a time when they no longer have the capacity to make decisions. It will guide the treating doctor to care for the patient in a way that the patient would have wanted, and I believe that will be very helpful in general practice. The area that it will have huge relevance will be transferring persons from nursing homes to acute hospitals who do not have the capacity to say no.
Why this Act matters to me. If my mental health deteriorates, I lack the capacity to make decisions for myself. I nominate my husband Pádraig to act on my behalf in carrying out my decisions and wishes if I'm unable to do it myself.
And this Act means that Margaret, the person I love and support, will feel happier and empowered if her wishes are both respected and listened to.
This Act means that the people in my care can be assured that they have the right to access information in a way that can maximise their understanding, and they are to be given more time to understand that information, to help them to make decisions. This matters because it shows respect for the elderly, the patients I look after.
The Act recognises that people need formal supporters to help them make decisions. These formal supporters are called interveners. A person can have a number of supporters to assist them with different decisions.
Nothing about me without me.
Nothing about me without me.
Nothing about me without me.
Nothing about Pádraig without Pádraig. Do you agree with that, Pádraig? Yes.